Hi, welcome to another Facebook Live video on mental health on the mighty, or you might be watching on depression on the mighty, or you could possibly be watching on my own website, Dr. Margaret Rutherford on Facebook. So I want to welcome everyone here. I am Dr. Margaret Rutherford, and I'm a clinical psychologist out of Fayetteville, Arkansas. I've been practicing for about 20 years. And back in November, Mental Health on the Mighty, I'd already done one Facebook live video for them on what I term perfectly hidden depression. And they asked me to become a bi-monthly video contributor to Mental Health on the Mighty, and I'm absolutely delighted to be here. I've researched a lot about depression. As I say, I've been in practice a long time, so I've treated a great many people with depression, and perhaps if you tune into this, you either have depression yourself or you love someone who has depression. So I really want to welcome you. You all have, I may have some letters after my name, but we all have a bit of wisdom that I would love to share. I would love it if we would share it with each other. Hi, Carrie. I have these because sometimes I'm going to have to look. Oh, your depression is awful. I'm so sorry. I may have to look, but I will try to get to your comments as we can. Let me tell you a little about how I've tried to narrow down this topic. And it's a huge topic, obviously, so it was a little difficult to narrow down. Thanks for the thumbs up and the hearts, by the way. I've thought about three different topics. The first one being, if you're in a committed relationship, if you're in a marriage, how does that depression affect your marriage, and how can you talk about it? We're coming up to Valentine's Day. That's like the holidays, anniversaries, birthdays. It's often very hard when you're depressed to actually engage and want to do anything with anybody. So I want to talk a little bit about how to manage that. The second thing I want to talk about is how loneliness and depression commingle. What's different about them? Obviously, loneliness is about the lack of a relationship, and perhaps you've ended one or you've never been in one. So we're going to talk a little bit about loneliness and depression. And then, hi, Sarah. And then the third thing, I'll read that in just, your friend passed away from suicide. Oh my gosh, I'm so sorry. We've had locally here a suicide as well, just recently within the weekend. So I'm so sorry to hear that. But the third thing, trying to keep on topic because I can get off on a tangent. The third thing I want to talk about is if you're depressed and you actually meet someone, and how, when do you tell them about your depression? So, okay, there's someone who's taking lithium. Hi, Ramon. Oh, she says this page is amazing. I don't know which one you're on. It may be Depression on the Mighty or Mental Health on the Mighty. I have been so impressed with their work. I discovered them maybe 6 months or so ago, and again, they've been wonderful and published a good deal about what I call perfectly hidden depression. You can look for me there. But anyway, I'll talk a little bit about me as we go. But let's go to the first topic. How do you admit and talk with your partner who you're in a committed relationship with about your depression? So many times we avoid those discussions because we just say we're depressed. I don't even want to engage. You tend to isolate with depression, or you're very agitated and angry. So I think that talking about the depression and how it's impacting the relationship is important without shaming yourself for it. Let me see what people are saying. It's the hardest thing. This conversation will be amazing for when I start my study with youth work. Great, great. Okay, so basically, I believe that it is better I've watched a lot of people try to deal with special occasions or family events or whatever, and they're depressed. And a lot of times my advice is to try to reach that balance between really pushing yourself to re-engage, pushing yourself to connect. Depression in and of itself is sort of is like a implosion of the self. So you want, part of the work is you reaching out to others. But there's a fine line between trying to re-engage with others and then expecting too much of yourself. So you have to balance that. sometimes you have to say, I'm simply too depressed. I'm going through a really low period right now, and I'm too depressed. I would not be fun. And I think if you talk to your partner about that and they trust that you're doing everything you can to get better, then you can say, I can't go to the wedding, or I'm just not up for the birthday party, or can I have a Valentine's rain check? Because I'm really working on this hard part of my depression in therapy, and I can't express to you how much I treasure you and care about you right now. I would rather people be that honest so their partner doesn't get their expectations up, and both of them say, okay, we can weather this. We can get through this. So I think that's the better thing to do. And again, you don't want to use it as an excuse to isolate when your partner gives you the gift of saying, well, I really understand that you're going through something hard right now. Andrew Solomon, who I just love, says the opposite of depression is not happiness, it's vitality. So sometimes it's that energy that you just don't have, okay? I'm reading a little bit. I've sabotaged relationships almost before they began for fear of being abandoned once they discover my imbalance. We're going to talk about that, the third topic, okay? Thank you. That's a great comment. So one of the things that I want you to remember this Valentine's Day, birthdays, anniversaries, you just got through the holiday season, is that sometimes the best gift you can give someone is not flowers or candy. It's that you are getting better with your depression. That's sometimes the best gift you can give, okay? And so, and if you're honest and don't shame yourself, I'm a horrible person because I struggle with depression, then your partner can join you in that and say, I know you're trying. Valentine's Day isn't really all that important to me, or we'll make Valentine's Day in April. We'll be creative. But you have to communicate about it first. Sometimes it is difficult to understand that your depression is having an impact on the people that you love. Michael Yapko talks about it in Hand Me Down Blues, which is a great book. And so that depression can be kind of catching in a family, and if one person is depressed, that a lot of, it can seep into the family. So you want to just do your best and seek treatment, maybe do medication, exercise. Probably if you're watching this, you already have depression, or you've struggled with it, or someone you love has. So a lot of the treatment, and it can be very difficult, especially with recurrent depression. So I think it's important for the relationship to understand that and respect that. Let me read another comment. The person I dated before used to say, you don't know how hard your depression is on me. It hurts so much. I never chose to have it. That's right. And I know you didn't choose to have it. Again, we're getting some questions. Let's just go on and jump to the third topic, and we'll come back to loneliness, okay? So because we're getting a lot of comments about how you talk to someone, maybe that you're not committed to, but that you've started dating or is interested in a boyfriend or a girlfriend. And what the last comment was someone who said, I tried to let my partner know that I was depressed, and then they blamed it on me. They believed I was causing it somehow. If you have classic depression, bipolar illness, seasonal affective disorder, the depression that goes along with PTSD, obviously you are not causing it. And that is an ignorance factor on a lot of people's parts. So you can educate. One of the things that I wrote about a couple of weeks ago, actually, in a post that you might want to look at, my website is drmargaretrutherford.com. That's the original name of drmargaretrutherford.com. And it was about loving someone with recurrent depression. It was a case study of a guy that came in with his wife who had depression. And I came up with a metaphor for him to try to understand, because he couldn't ever see any triggers for her depression, but she had genetic factors. She had bariatric surgery, and she struggled with her weight. She was struggling with empty nest, and just some self-esteem issues that would trigger depression every now and then. So I used this metaphor. I wish I had it right in front of me because I could read it. I hope I don't forget any of it. But I said, imagine that you were living in a house and there were beautiful carpets all over the floor, really treasured, wonderful carpets. And it was your house to live in. And you looked around and there were some beautiful things in the house. You didn't want to leave, but you had to live in this house. Now, the magical thing about this house was that every night the powers that be would come and dig a hole in the floor and cover it up with a carpet. Now, you couldn't move anything, but it was your job to get up the next morning and walk around in your house. Well, you can imagine how you'd feel. You'd feel timid. You'd feel frightened. You'd feel nervous. You'd feel agitated because you would never know when you might fall in a hole through the carpet, right? So you would gradually, if you didn't fall in a hole, get kind of, cocky, like, okay, I got this. This whole thing is not going to bug me, right? And then all of a sudden, you fall in the hole. That's what people who have recurrent depression feel like. They never know when the next trigger. Now, they can get good at identifying triggers, but sometimes you just don't know what the next trigger is going to be, and you fall in the hole. Now, you get better at getting out of the hole. You can, at least, with appropriate treatment, medication, whatever works for you, enough sleep, then you can get better at falling in the hole. But you are going to fall every now and then. You have to manage your depression, right? Those of you with bipolar disorder know this. Those of you with major recurrent depression know this. So it's a hard concept. But the guy looked at me and he had tears in his eyes and he said, oh, I get it. I get it. So maybe that will be helpful to you. Let me read another comment. After my suicide attempt, I broke up with my ex-boyfriend because I didn't feel stable enough. So it would be fair enough for him to have to deal with it. How can I, as a person who will be in other relationships, whatever. So you're talking about it not being fair for someone to be in a relationship with you when you have severe depression. Well, my feeling is that that's really not up to you. It's kind of like, again, Michael Yapko, I've been to several seminars of his, would say, it's really not your right to decide what other people are going to think about you, whether they think you're a great person or whether they think, I'm the kind of person, I don't care I care if you deal with depression, I care if you get suicidal, but I love so much of you that I need to try to understand. I can't fix it for you, I can't do anything like that, but I can try to understand what you go through, and maybe I can help. So it's not, I understand that it is difficult to know that you have a condition, that you have to manage a condition that is going to impact someone who loves you. That says a lot about your own integrity, that you care, okay? You care that something that you have, just like you would care if you had diabetes, just like you would care if you had irritable bowel syndrome, just like you'd care if you had cardiovascular illness. You care because you love the person and you don't want their life to be impacted, but that's just part of loving someone. Some of us have really strange mother-in-laws or father-in-laws. Some of us have other family issues. Some of us have physical issues. Some of us have mental issues. So you get the whole package when you love somebody. And I would urge you to think, it obviously is something I want them to get to know about me. I want them to understand that. I don't want to avoid talking about it. If it's severe enough, they're going to find out anyway, right? Because you won't be able to stop it. But I would really recommend that you think about accepting it yourself. Maybe that's really the key. The more I think about it, that's really the key, because I think sometimes we project our shame onto other people, and so we think they are struggling more than they're actually struggling with us having to deal with depression. Now, I am not saying, guys, and you probably know this better than me, that there is not significant stigma or prejudice against depression and other mental illnesses. I know that. Of course there are. I have panic disorder. I have anxiety. I've had a history of an eating disorder. I don't like it. I know that some people if they saw me have a panic attack, they go, oh my gosh, I never want to go to her as a therapist. She's crazy. So I get that. But the only thing we can do that is in our power is to be honest about who we are. Whether we're someone who struggles with depression, whether we, like me, someone who has panic disorder, the only thing we have as a tool for people to help understand is our acknowledgement and our honesty about what's wrong. Okay? Let me read another comment. Thanks. I love these comments. Is depression really just in your head? My family tells me that all the time. No. Depression is, of course, your mind is affected by your depression, and frequently your thoughts can get very negative, or you can obsess, or you can worry. So yes, depression is about your mind, but it is not in your mind. It is not a fantasy. Depression is real. I watch people every day get better, and it's like I'm meeting a new person than the one they were when they came in depressed. I see light in their eyes. Their thinking gets more clear. They get more hopeful about life. They get more goal-directed. So it's not in your mind. It is of your mind, okay? The cognitive part of the mental part of depression is just as real as the emotional part. Okay, here we go. The other day I was having an anxiety attack, and my boyfriend asked me what was the main cause to why I was having one, and I explained to him that I don't have a reason for the attack, and it just happens. I have certainly worked with people who can identify a trigger for panic, and I don't want to go too much into panic because this is on depression. But actually, I've never met anybody that has severe anxiety that's not depressed about it. So, and there are some panic attacks that don't seem to have a trigger. Actually, if you go into therapy and have a good therapist who knows what he or she is doing, then you can track back to what may be triggering those panic attacks. You can't always, but you can often, and it can help you begin to circumvent or prevent yourself from getting so anxious. So that's one thing. Somebody offered a video. Thank you. Okay, here's from Carm. How do you get help with depression? I have awful thoughts of dying and other dying. I cry all the time, and I've spent days in bed, but I keep going because of my kids, but I'm miserable. Well, you have to admit to somebody what you're really like. You have to admit that you're really depressed. Again, we're talking about relationships and depression. If you're hiding it or trying to hide it, then you will stay miserable inwardly. Again, I've done a good deal of writing and researching on perfectly hidden depression, and I don't know, that doesn't necessarily sound exactly what you're struggling with, but you have to reach out to someone, because if your depression is getting worse and you're isolating and not wanting to get out of bed and that kind of thing, which are pretty serious signs of depression, then you're not advocating for yourself. And you have to not believe the people that tell you, oh, it's all in your head, you just need to snap out of it, put a smile on your face, whatever. That's not a permanent solution by any stretch of the imagination. So you need to seek out people's help that actually are educated about it and know what they're doing and can help you. Let's talk a little bit about the difference between depression and loneliness. Again, we're coming up to Valentine's Day. There are a lot of people who don't either have lost their relationship, they're divorced, they're estranged, or they don't have one at all that they're enjoying. Perhaps they've never had one. Now I see some questions about medication. We'll talk a little bit about that. So, what's the difference between depression and loneliness? I mean, you're not always lonely when you're depressed. You could isolate when you're depressed, but that's not the same thing as loneliness. With loneliness, you want connection. You're looking for connection, and you can't find it. It's a very helpless feeling. Now, there's a lot of helplessness in depression. So they obviously can commingle. When you're lonely, if you've been lonely long enough, that can lead to depression, because it eats away at your self-esteem and your self-worth. One of the things, again, I like to tell stories, and one of the stories that are kind of a thought exercise I give to somebody who's struggling with loneliness is this. Imagine 6 months from now, the powers that be came to you and said, okay, you're going to meet someone who's going to be very interested in you in 6 months. How would you spend the next 6 months? And I get varied answers, but the answer I'm looking for is, well, I'd make my life as happy and fulfilled as I possibly could. I love that answer, because the reason why it's a great answer is because if you are urgent, if you are looking around and thinking, I'm never going to find anybody, then one, of course, that can lead to depression. But two, who you're going to attract in that 6-month period of time is somebody who's what I would call a rescuer. Somebody who's going to come in and your life's out of control. Your self-esteem is in the what's the term I'm looking for? Anyway, it's low. And so you're going to attract someone who's going to fix you. And those relationships, one, eventually you get tired of being fixed. And two, they're not great relationships. The savior-victim relationship is a bad dynamic to get into. So one of the things about trying to deal with loneliness is recognize that there are things you have control over, and that you have to tolerate the ambiguity of not knowing. If you do it successfully, and don't let it depress you, is you have to tolerate that ambiguity of not knowing when someone may come along. I want to say too that I think depression and loneliness have a sense of alienation in common, meaning that when you're depressed, you look out on other people and their lives are going great and yours isn't. I think loneliness is somewhat like that you see other people as having connections in their lives that you don't have. So that sense of alienation, of not having what other people have. And that can be really devastating. So focusing on what you do have is important. Let me read some more comments. Just always be there and be open when she's ready to talk. Sometimes we don't want to talk. We can't explain, feel ashamed, or feel I don't want the other person to suffer. Yeah. Okay. Have you ever gotten mad and you call somebody and you're really, really mad, and then they get madder than you, and you get kind of uncomfortable, like, well, wait a minute, and you actually start defending the person you're angry with? When someone takes on your depression, that's not helpful. You have to educate them that you want them to listen, but it's not helpful to you for them to get sadder or more emotional than you are. Their job is to support you, and they can't fix you. Again, like I said a few minutes ago, they cannot fix you. They cannot make you less depressed. That is up to you. They can support you getting the treatment you need. They can babysit the kids while you go into therapy. They can take some of your responsibilities that are just overwhelming for the moment and help you with them. And then your job is to really work on your depression. Your job is to read. Your job is to journal. Your job is to go to therapy. Your job is to consider medication or take medication. Your job is to exercise. Your job is to meditate and be mindful. Your job is to do whatever you can to try to get that depression more manageable. Okay? One more. I have a question. With depression, you said it's important to go to a professional who knows how to handle and help you through it. What if you don't have the money to get to that professional? Okay. Well, and I volunteer at the free health clinic called Welcome Health here in Northwest Arkansas, and there are free health clinics all over everywhere. So they also often are staffed with mental health professionals. There are community centers. We also have one here, Ozark Guidance Center, that charges, I think, $10 a session for people. Yes, maybe you can't see the therapist that everybody sees or whatever, but you can get some help, okay? Again, you could have 2 or 3 sessions with somebody that really knows what they're doing, and they can get you started on the right path, on at least a path that's different than one you're on that's not working, okay? So I know that money is an issue. In fact, I did a study, a couple of years now, and money was always the second reason why people said they wouldn't come into therapy. So I get it, and yet, other things, your depression has an emotional cost to you. So I can't, make your decisions for you, but you can look for free health clinics. You can go to YouTube and look at YouTube videos. You can Listen to TED Talks. You can, Andrew Solomon, who I mentioned before, has a wonderful TED Talk. You can go to the library and get books. If you adopt a victim stance, like, well, I don't have any money, so I can't do anything about it, then you are not advocating for yourself, okay? Is there full recovery from conversion disorder, and what does that look like? Okay, well, conversion disorder is a whole nother topic, so I actually did my dissertation on conversion disorders, but they are complicated to explain. Complete recovery, that's tough, but there is treatment for conversion disorder. I'm afraid my teacher will hurt me when I say that depression is the reason why I didn't do my thesis. I think she'll laugh at me and shout at me or say, stop making excuses. She might. If you're not doing your thesis because and you're really trying to manage depression and you're doing everything you can, then you can go to her and say, these are the things that I'm trying to do, but this is overwhelming and I need again, you may be projecting your own shame onto her, thinking I'm going to be rejected because I myself find this so difficult and overwhelming, and I'm mad at myself because I can't finish my thesis. Obviously, if you're in a program getting a thesis, earning a thesis or earning a master's, you've done a lot of things very, very well. And trust that, just the fact that you tell her you're depressed, that's one fact she knows about you. You obviously have done a lot of work to get to where you are with a master's. I could go to free clinics, but I can't afford the medication. Well, in free clinics, the medication's free too, okay? So you have to go and check it out, all right? So let me, gosh, these are great questions. It's very difficult for me to open up to others, and even my doctor did nothing after I told her. So I'm too afraid to go to the therapist. It's so hard for me to trust and speak to other people. Medical doctors, sorry, that was a long sigh, wasn't it? Medical doctors sometimes have trouble with things that aren't tangible. Many of them are wonderful with mental health issues. Some of them are not. I would invite you to search for somebody that has the reputation of understanding mental disorders and helping with them. Therapists, you may go to a crummy therapist. You may go to somebody who doesn't have a lot of empathy or understanding of your particular mental issue. Again, I'd ask around. I have more people come to my practice because they say, I talked to a friend and you really helped her, so I want to try to come to you. So again, use your connections, okay? If you get disappointed, keep on looking. All right. Well, I'm trying to think what time it is. Okay, wow, we've already done almost 30 minutes. Thank you so much for tuning in. I want to tell you a little bit about me again. I'm Dr. Margaret Rutherford. I have a website called drmargaretrutherford.com. I have a new podcast that is both on iTunes and Stitcher. I talk about depression there. It's called Self-Work with Dr. Margaret Rutherford. And I'm on Twitter. My Facebook is facebook.com, Dr. Margaret Rutherford. I'm on Twitter at Dr._Margaret. And I'm going to be back on mental health on the Mighty in April. I'm not sure what we'll be talking about, but it'll have something to do with depression. Oh, you can email me as well. I answer every email. It may take me a little while, but I do answer it. It's askdrmargaret at drmargaretrutherford.com. Thank you, everybody. Thank you so much, again, for your own wisdom. I hope you'll join me on my website or on my podcast. I'd love to have you as a subscriber or a reader. And thank you so much for being so highly involved today. I'm going to go back and pick up some of the questions that I did not get to answer. And I so appreciate you. Hope you have a warm, cozy Saturday afternoon. And maybe you can get a little fire going like I did, except, you know what? I've got old Christmas presents in a pile over there that my husband still hasn't cleaned up. So, you never know. Okay, thank y'all so much. I'm Dr. Margaret Rutherford, And you've been on Mental Health on the Mighty. Take care. Bye-bye.